Knock, knock. Open the curtain. Hello there, Miss Patient. How are you doing today? Well, glad to hear. So my name is Connor. I'm a Year 3 RM student from ABCO. And the reason I'm here today is I'm going to be inserting a Foley catheter into you. So you may have heard a bit of this from your doctor, but right now you've got some skin breakdown between your legs here. Now you're very weak, you're a little bit sick right now, so it's hard to go to the bathroom, right? And when we urinate inside these briefs, sometimes your skin can get irritated. So what we're thinking is that we want to put this tube in. It's going to go into your bladder through your urethra, and then when you do have to void or pass urine, it's going to go through the tube into the bag there. And the goal of that is to preserve the skin between your legs there. Does that all sound good to you? Sounds good. And I'm just going to check your wristband here. Can you tell me your first name and last name? Thank you. And your date of birth? Sounds good. Now, the thing I'm going to be inserting here, this is made of latex. Are you allergic to latex by chance? Didn't think so. Thank you very much. And I'm also going to be cleaning you with some iodine solution. Do you have any iodine allergies? Sounds good. Thank you. So what I'm going to do is I'm going to elevate the bed so it's up to about right here, comfortable working height for me. And what we're going to do first is I'm just going to do some pericare for you, get you cleaned up. Same thing we did this morning, all right? So I'm just going to expose your bottom end here. So I'm going to lift the gown up, and then the blanket I'm going to pull down just enough to expose my client's genitals here. And I'm going to do some hand hygiene, put on my clean gloves. And then for supplies here, these 3 brown things, these are going to be my Vernicare wipes. And then this surface disinfectant is going to be my cleansing solution. And this here is curtain, but if it was an actual work table in a hospital, I would spray that down and wipe it down before I set up my workstation. So for pericare, cleansing solution, and we're going to go clean to dirty here. So we're going to go front to back, starting from the center for the urethral meatus. 2. And then we'll just cleanse the minorate here. All right, so I'm just gonna get our supply set up for the insertion now, okay? So I have my drainage bag here. Now, this client is not on specific in and outs. We're just here to preserve her skin, so we do not need a specific measuring one, just a normal drainage bag here. We're gonna open this guy up. Here's our Foley insertion set. Here's our actual Foley. And this will be a replacement for the iodine swabs. We'll pretend this is inside and sterile. And we'll sanitize now. So we'll have some gloves on soon. And that tab would have been folded, so I could have just pulled out the top usually. Sterile gloves, and I want the cuffs. They can be on the border, but we'll just have them right there. This drape I'm going to put on very soon. Fenestrated drape, I'll do that with sterile hands. Specimen container, I'm not going to be using this. Everything else can stay in there. I'm going to hand myself the drape here. See if I can get myself a corner. We want shine down. And at this point, I'd have my patient have her heels together and then spread her legs out, kind of like a butterfly for me. And we're going to open this guy up. And this blue package is sterile. I'll take this out once I have my gloves on. All right, so I'm gonna hand myself a sterile glove here. Let's get oriented, which hand is which. Yes, that'll make sense. So let's grab this one. And then once both are on, we can make things a little bit more manageable. manageable. All right, we're gonna place our fenestrated drape now. And be very careful. These hands are sterile now, so I don't want them to go anywhere. I'm gonna bring this guy over. And do a little 180 here. All right, so I'm gonna start off, I'm gonna open this guy up. 15 centimeters above the garbage. I'm going to attach the syringe here, take the cap off. This is filled with 10 milliliters of water. I'm going to insert this now while both of our hands are still clean. I'm careful not to let my cups touch anything. These are going to be my iodine swabs. I'm trying to get my fake iodine swab out. And then lubricant here. So we're going to insert the tip of the Foley into this package here. And we are now going to start to clean our client here. So with the iodine solution, we would open this up, have them accessible. And I'm going to take this hand. This hand is now contaminated. I'm going to spread our labia here. I'm going to start outside working inwards. We're going to do the outside first. Discard, grab a second one, outside. Discard, grab my third one, and then down the urethra meatus. Discard. All right, so we're ready to insert the catheter here, Mrs. Patient. So what we're doing is we're going to take some deep breaths together. And then I'm going to slowly start to insert it, and just let me know how you're doing as we go through this, all right? So we're going to get this guy out of the lubricant here. I've identified the urethra. And slow, deep breaths, okay? We're going to start advancing it now. All right, doing okay there? We're going to about 5 centimeters plus 2 just to be safe. All right. So we're going to start to inflate the catheter balloon now. And as I do this, I'm confident that we are advanced far enough, but I'm going to watch my patient for any negative reaction as we do this, because they shouldn't be able to feel this part. Doing okay there? Sounds good. So here, this hand is dirty, but I'm going to grab the parts of this that do not need to be sterile. I want to not tug, but just make sure that it's taut and in situ. Looks all good there. And let's say we had about 30 milliliters of urine return here, straw yellow. So what I'm going to do now is that this would usually have a sterile cap. We'll have this off. Sterile to sterile, connect these two. There we are. And then this would be hanging at the edge of the bed usually. We're just going to drop it down there for now. And so we're going to start to get cleaned up here. And in this case, I'd want to have this secured to the leg. And then we're also going to get this out of here, cover our patient back up. If I had another vernicare wipe with me, I would also clean any excess lubricant off from my patient. I'm also going to want to cover my patient back up. I'm going to lower the head of the bed to the lowest position, ensure the call bell is in reach. Anything else I can grab you? Sounds good, thank you very much. I'm going to leave the room and I'm going to document that I inserted a 12-gauge Foley catheter into my patient. She had about 30 milliliters of straw-colored urine return. Put in 10 milliliters of sterile water into the balloon. Patient tolerated well.